Hello everyone. In this video, we'll be talking about monobactams and cephalosporins. We'll begin with monobactams. So examples of monobactam includes IV Aztreonam, and then special characteristic include it specifically binds to penicillin binding protein 3, which is PBP3. It inhibits peptidoglycan cross-linking, and it is less susceptible to beta-lactamases. Clinical uses include effective against gram-negative bacteria only, including nosocomial Pseudomonas, Haemophilus influenza, and Neisseria meningitidis. It's not effective against gram-positive rods or anaerobes, and it can be used as an alternative for penicillin. In allergic patients, there is no cross sensitivity with penicillins. It can be used as an alternative to aminoglycosides for patients with renal insufficiency because it is synergistic with aminoglycosides. Broad spectrum coverage in combination with vancomycin or clindamycin. Adverse effects are rare but may include GI upset, injection reactions, and rash. Now let's talk about cephalosporins. So basically cephalosporins are divided into 5 generations. Okay, got first generation, second, third, fourth, and fifth. So let's look at a few examples. First generation has cephalexin, oral, IV, or IM cefazolin. Second generation cephalosporins include orally we've got cefaclor, cefuroxime, and IV we've got cefuroxime, cefoxitin, cefotatin. Then third generation oral includes cefixime, cefpodoxime, IV we've got ceftriaxone, cefotaxime, ceftazidime, and IM we've got ceftriaxone. Fourth generation IV cefepime and fifth generation cephalosporins includes IV ceftaroline. So let's talk about the microbial coverage. So activity against gram-positive bacteria. First generation is highly active. Second generation is less active than first generation, and third generation is least active amongst all cephalosporins. Then fourth and fifth generation are highly active. Then gram-negative bacteria coverage. So first generation covers Proteus mirabilis, E. coli, Klebsiella pneumoniae. Second generation covers Proteus mirabilis, E. coli, Klebsiella pneumoniae, Haemophilus influenza, Klebsiella aerogenes, Neisseria serratia. Then third generation has extended spectrum. Fourth and fifth also have extended spectrum activity against gram-negative bacteria coverage. So fifth generation cephalosporins act against methicillin-resistant Staphylococcus aureus. Then Listeria, fifth generation cephalosporin, Pseudomonas, third generation cephalosporin, ceftazidime, and cephalosporin, and fourth generation cephalosporins, Enterococcus. Only the fifth generation cephalosporins can work against it, and only against Enterococcus faecalis. None of them work against the atypical, such as chlamydia, mycoplasma, or legionella. So, special clinical considerations include cefazolin for perioperative wound infection prophylaxis. It covers Staphylococcus aureus. Then, under third generation, perioperative wound infections, you can use it for Staphylococcus aureus prophylaxis. Ceftriaxone specifically, it has good CNS penetration and it's used to treat meningitis. It can also be used for gonorrhea and disseminated Lyme disease. Then, fourth generation cephalosporins are used for severe life threatening infections, including nosocomial infections. So, special characteristics include they are less susceptible to penicillinases. Adverse effects: potential cross reactivity in patients with penicillin allergies. The rate is low even in patients with allergy to penicillin. Then, autoimmune hemolytic anemia, vitamin K deficiency, which can increase the risk of bleeding, disulfiram like reactions, especially when consumed with alcohol, may lead to flushing, tachycardia, hypotension, increases nephrotoxic effect of aminoglycosides when administered together with cephalosporins, neurotoxicity, it can lower the seizure threshold. Mechanism of resistance include inactivation by cephalosporins, a type of beta-lactamase. Change in transpeptidase BBP structure. Now we'll talk about glycopeptides. So examples include oral or IV vancomycin, topical bacitracin. Mechanism of action. So they bind terminal DALA of cell wall precursor peptides, inhibition of cell wall synthesis. So basically they inhibit peptidoglycan formation. There's bacterial death, which is bactericidal effect against most gram-positive bacteria, and it has a bacteriostatic effect against Clostridium difficile. CNS penetration is only when there's increased permeability of the meningeal vessels, which is what meningeal inflammation. Route of elimination is renal via glomerular filtration. Clinical use includes specially effective against multi-drug resistant organisms, is effective against a wide range of gram-positive bacteria only, such as MRS, which is methicillin-resistant Staphylococcus aureus, Staphylococcus epidermidis, Enterococci, if not vancomycin-resistant Enterococci, Clostridium difficile. Adverse effects. So on IV administration, you can get nephrotoxicity, ototoxicity, which is vestibular toxicity, thrombophlebitis, Rodman syndrome, which is an anaphylactic reaction caused by rapid infusion of vancomycin, non-specific mast cell degranulation, which is rapid release of histamine. Symptoms include diffuse flushing of the skin, pruritus, mainly of the upper body. Pruritus is basically itching, muscle spasms and pain in the back and chest, possible hypotension and dyspnea. And Redmond syndrome can be prevented by slowing the rate of infusion and pre-treating with antihistamines. This Grass syndrome, neutropenia, dysgeusia, and GI side effects such as nausea, vomiting, abdominal pain. Oral administration, predominantly dysgeusia and GI side effects. Contraindications. So you need to consider use in pregnant women only if the benefits outweigh the risks. Mechanisms of resistance include modification of amino acid DALA to DALA-DLSC. Occurs mainly in Enterococcus, such as in Enterococcus faecium, less in Enterococcus faecalis. Beta lactam is resistant. So that's all. Thank you.